This is Heart Rhythm TV, day 3 here in Seattle. Just did a pitch competition, had the pleasure of hosting it. We had 5 finalists. One of them is Jean-Philippe Couderc, who has French roots, but is also a biomedical engineer that's worked and collaborated with Rochester, which I have as well. So it's a small world. It's great to have you, JP.
Thank you. Thank you. Very happy to be here.
Now, JP just pitched that we're going to detect atrial fibrillation based on the face. Facial recognition, you open up your phone, but you believe that there's a way with VPG Medical that you can detect irregular rhythms.
Absolutely, and we have actually already demonstrated that in a series of clinical studies where we actually put our app in the hands of patients that were already diagnosed for AF, that were paroxysmal AF patients, and they went home with our app and we let them use it for a couple of weeks, and then we get the data back. And we showed, in reference to an ECG patch that was also wear at the same time, we showed that our app could actually detect irregularity of the pulse associated with the presence of an AF rhythm on the ECG patch. So we are very excited about these results that we published, by the way, in the Cardiovascular Digital Health Journal, last year. And we have very, very promising results, and we are on the path of developing a little bit more validation work and clinical studies.
So the future really is here, because there's a lot of things that we keep talking about, but it's not really been delivered yet. We don't see it. But the idea that with your screen time, for me, it's like 4 or 5 hours a day on the phone. It's such a wasted opportunity not to be able to see someone's. And now you're looking at facial changes in color. I mean,
absolutely.
I'm not an engineer, but what you were describing was you're seeing a pulse by face color changes.
Yes, and this is a very simple phenomenon where the ambient light is refracted and reflected from the skin in a way that is modulated by the amount of blood you are underneath the skin, right? Mm-hmm. So when your heart beats and the volume of blood changes, the way the ambient light reflects from your skin changes. A very well-known phenomenon is blushing, right? Everybody blushes at a certain point. What we detect,
but you don't actually see the pulsatility when people get red. But this is what the technology is.
Yeah, it exists on a bit-to-bit basis. It's invisible to a naked eye, but actually our technology can detect it and measure it, and we can have a beautiful bit-to-bit pulse signal extracted with a camera that is on your smartphone, a camera that is on your laptop or even personal computer.
It's amazing to think about that. How long is the acquisition that you need? How long does someone need to look in the smartphone to be able to make that recording?
So we do a detection of AF on a 30-second actually recording of the signal. We call it VPG for video plethysmography. And just 30 seconds of continuous signal, we can actually detect if the rhythm is irregular or not. We extract the heart rate. We extract also respiratory rate. But we have these algorithms that use machine learning and also standard signal processing technique to really extract these vital signs without touching the patient, with just a camera. And think about how much time you spend in front of your camera, in front of your devices.
Well, I already volunteered. I'm about 4 to 5 hours on screen time, which is embarrassing, but probably standard. Is that the average
very standard.
amount that someone
average
uses?
Per day, people spend around 4 hours per day. For us, it's an opportunity to harvest all this actually information about the patient's pulse.
So the future really is here. We might be able to look in a mirror, look in our phone. It could tell you.
Absolutely.
Maybe it won't even let you open up your phone with Face ID if you're in AFib, because you should be going to the ER or at least alerting someone.
Absolutely,
about
and we have to recognize the people. Our app actually detects the presence of a human face as the first step. The second step is to really recognize who is using the device. And we have proprietary ways of doing that. And in a sense, it helps us really associate any data with the right person when people are using these devices. And you're right. You can imagine that this technology could be embedded in any kind of, I would say, equipment that has a camera.
Sure.
It's not only computers, obviously.
What about airport screening? Sometimes, I go to China and all of a sudden it's taking temperature scans of all the people walking through so rapidly.
Yeah.
Could you imagine a day separate from your technology or with it that you're literally like AFib?
Absolutely. So we have actually, we had a project where we wanted to use that in the waiting room of ER, right? Because the patients come into the hospital, they are basically waiting. There's no really monitoring happening. Now, if you have a camera there that is able to really monitor their heart rate while they're waiting to be really accessing to the services, it could be helpful for hospital to triage the patients the right way. So there's many opportunity for this technology to be able to monitor patients at very different levels. Think about it, cameras are everywhere now. It's not a sensor that is going to disappear. They are now in our everyday life, and we need to leverage these kind of things to help people gather information about their health.
Well, I came here to get a glimpse into the future and also to find collaboration. So hopefully we can work together at University of Arizona Health Sciences if you need clinical trial partner sites. So this is exciting.
I'll be delighted. Thank you so much.
Thank you for joining us.
Thank you.